When I was seeing patients in clinic, I always had one question in my mind. Was I really doing the best? What if the drug that I chose was not the best drug for the patient? It's hard because there are just so many drugs out there, and it's hard because the patients are all different. So how do I tell which drug would work the best for this individual patient sitting right in front of me? You might ask, aren't there clinical trials for that? Well, there is a ton of research on whether a drug works or not. But there is little scientific guidance on how to choose the best fitting option for this specific patient. This question tortured me for a while. And in fact, that's why I decided to study epidemiology. My thesis is on predicting which drug would work the best for individual patients who received kidney transplants. Kidney transplantation offers a perfect setting to pursue this study for two reasons. First, these patients take specialized drugs for the rest of their lives. So it's very important that each patient receives the right type of drug. If the drug is too weak for the patient, the transplanted kidney cannot survive. But if the drug is too strong for the patient will develop cancer, infections, and so on. So how do we find the sweet spot between these two? Because it will vary from person to person. Again, there is no solid science behind this. Fortunately, we have a data set of every single transplant recipient in the United States. We know what the patients were like, what drugs they took, what disease they had, and how long they survived. I built a statistical model using the data of every single eligible patient in the United States over the last decade. So what does this model do? Doctors can enter a specific patient profile to this model, and this model will predict outcomes with drug A, outcomes with drug B, and so on. And by comparing these potential scenarios, we can identify which drug would work the best for this individual patient. For the next steps, we plan to create a computerized tool based on this statistical model, which can help doctors make this important decision in real time. Exciting, right? It's been quite a journey. And what I'm also thrilled about is that this methodology can be applied to any diseases. Hypertension, diabetes, joint pain, you name it. There must be a single best option for you, and this model can find it out for you. Thank you.